Hello everyone, today we are going to talk about pharyngeal arches. This is the most basic and important concept in embryology, and let us have an overview. So this is the developing embryo. Developing embryo has a swelling that is at the cranial end. This is the forebrain swelling, okay, and it has a pericardial swelling that will give rise to the pericardium or the heart, and it has a stomachium, that is the primitive oral cavity, and then it also have some arches that are called as the branchial arches, and it has various derivatives, and from various muscles, arteries, cartilages are formed from these arches. So this is a very important process in the development of head and neck. Now let us see. This is the developing embryo. As I told you, this is the cranial end, and we have pharyngeal arches. So maxillary process, mandibular process, these are the pharyngeal arches. And if you look at the overview, we have the cranial end, and this is the caudal end. Now every pharyngeal arch will have its own muscle, and obviously if muscle is there, there will be a nerve to supply. This is the first pharyngeal arch. This is the one in orange is the first pharyngeal arch, supplied by trigeminal nerve. This is the second pharyngeal arch, supplied by seventh cranial nerve. This is by the glossopharyngeal nerve, that is the third arch, and fourth and sixth arch will be supplied by the vagus, that is the 10th nerve. Then let us move on further. Now this is a cut section. As you see, this was the cranial end, and this was the cardiac end, or the cardiac swelling, pericardial swelling, or this was the forebrain, the primitive cavity. And then if we cut through the section, we can see the pharyngeal arches. These are the pharyngeal arches. The pharyngeal arches are derivatives, or these are formed from ectoderm, endoderm, and mesoderm. The pharyngeal arch will be mainly formed of the mesoderm. So the inner part, this is the mesoderm, whereas this one will form the ectoderm, and this one will form the endoderm. So all three embryonic layers will be forming this, and the as you see in this lower figure, we have, these are the pharyngeal arches. So the outer end will be of ectoderm, inner end will be of endoderm, and in between is the arch, that is the mesoderm. And this mesoderm will form its own, will have its own artery, its own muscles, its own cartilage, as we see here. See, this is the pharyngeal muscle, this is the nerve, this is the cartilage, its own artery. Everything is inside these arches. This is, as I said, is the ectoderm, and this is the endoderm. So it is often called as the ectodermal cleft, and endoderm will be called as the endodermal pouch. Okay. Now we have got the basic, so we'll move further. See, this is the head and neck region. I told you this is the head part, that is the cranial part. Then we have the pharyngeal arches. See, the green is showing the cranial nerve 5, then cranial nerve 7, 9, and 10, and how the structures are formed in this. See, these are the derivatives of trigeminal, then of facial, then of glossopharyngeal, and then of vagus. That we'll talk about. Now let us talk about the first arch. We already read that it has maxillary and mandibular processes. So the maxillary process will give the maxilla, the palatine bone, the zygomatic bone, and the temporal bone. The mandibular process will give the Meckel's cartilage, that will form malleus, incus, stylomandibular ligament, anterior ligament of malleus, and of course the mandible. Looking at the muscles, there will be muscles of mastication, that is the masseter, temporalis, medial pterygoid, lateral pterygoid, anterior belly of digastric, tensor tympani, and tensor palatini. Nerve will be, of course, the mandibular nerve. Artery will be maxillary artery. Now see, look at this. This is the Meckel's cartilage, this is the malleus, this is the incus, and then it has the stylomandibular ligament, and it is forming the muscles of mastications like greeneria temporalis, masseter, anterior belly of digastric. All these are supplied by the pharyngeal arch 1. Next, moving on to the second arch. It is also called as the hyoid arch. The cartilage will be Richard's cartilage. So since it is the hyoid arch, and we know the nerve is the facial nerve, so stapes, styloid process of temporal bone, stylohyoid ligament, and since it is the hyoid arch, so the lesser horn and the upper half of the body of hyoid. So only the upper half. See here, we have only this is the hyoid bone, and only the stapes, styloid process, and upper half of the body of hyoid is developed from the facial nerve 7. Then looking at the muscles, we have stapedius, muscles of facial expression, posterior belly of digastric. Anterior belly of digastric was in first arch. Second arch will have posterior belly of digastric, and the muscles will be auricular muscle and stylohyoid muscle. See, auricularis, posterior belly of digastric. This is by the facial. Let me move. So auricularis here, okay, and muscles of facial expression, all this. Then posterior belly of digastric. These are all supplied by what? Facial nerve, that is the second branchial arch nerve, and the arteries will be hyoid artery, very easy to remember, and stapedial artery. Now the third arch. Cartilage will be, of course, the upper half of the body of hyoid is by the second arch, so the lower half of the body of hyoid will be by the third arch. Lesser horno in the second arch, and greater horno in the third arch. Muscle will be, since we know that this is the this glossopharyngeal nerve, so the muscle will be stylopharyngeus, and artery will be common carotid artery. Now one more thing that we have is these cartilages. We all know there is something called as hypobranchial eminence. Those who need a video on that, why it is necessary, it helps in the formation of tongue. So I'll take up a different video on that. So third branchial arch and fourth branchial arch both have the hypobranchial eminence, and they together, the hypobranchial eminence has a cranial end and one is the caudal end. So the cranial end will form the posterior one third of the tongue, and caudal end of hypobranchial eminence will form the epiglottis. Therefore, it is the third and the fourth branchial arch both have the hypobranchial eminence, and the caudal part will form the epiglottis and the cranial part posterior one third of the tongue, and this will also form the thyroid, corniculate and cuneiform. Understood? Next, we are going to their arteries. So, third branchial arch we already talked about. It is the common carotid artery. Now, fourth branchial arch and sixth branchial arch. I told you vagus nerve is supplying, but the fourth branchial arch will be supplied by the superior laryngeal nerve of vagus, and sixth will be by the recurrent laryngeal nerve of vagus. Whereas the blood supply of fourth will be right and left. Right side will be subclavian and left side arch of aorta, and the sixth branchial arch right side will be pulmonary artery and left side will be ductus arteriosus. Let me tell you more in detail. Now look at this. We told first arch artery will be maxillary artery, second arch artery will be facial, okay, third arch artery will be common carotid artery and also some part of the internal carotid proximal part. Then the right side, the left side, it will be by the arch of aorta. So easy. This is the arch of aorta, and so over to the left side by the arch of aorta and over to the right side by subclavian. So this one is the fourth arch. Now come to the sixth arch. So over to the left it is by, see, ductus arteriosus, okay, and here it will be the right pulmonary artery. Easy. I have also given a table. Look at this. So fourth branchial arch, right side is right subclavian, and let me add a figure here to make it easier. Okay, now look at this. It will be easier for you to learn. Now look at this. We have first arch we all talked about. Now we are talking about the fourth arch. So fourth arch comes in, this is the fourth arch here and here, okay, in the blue. The left side we have the arch of aorta. Left side we have the arch of aorta. 1 minute. Okay, so this in blue is this is the left side arch of aorta. Right side we have the right subclavian, and sixth arch we have ductus arteriosus left side, and right side will be having the right pulmonary artery. Okay, we're good. Next we are talking about the muscles. Next, let us talk about the muscles. It's a bit tricky and you have to memorize it, like the muscles. Over to the fourth. I told you fourth what cartilage will be there. We have the thyroid cartilage, okay, and sixth brachial arch we have the cricoid cartilage. So here all constrictors by the fourth branchial arch except cricopharyngeus. So since the cricoid cartilage is in the sixth branchial arch, remember by cricopharyngeus will be from the sixth pharyngeal arch, whereas all other constrictor, the superior, middle and inferior constrictor and its thyropharyngeus part plus the cricothyroid will be supplied by the fourth branchial arch artery, and nerve will be superior laryngeal nerve, whereas all other intrinsic muscles of thyroid except cricothyroid, that is supplied by fourth, will be supplied by sixth branchial arch. Easy. So cricoid and arytenoid by the sixth branchial arch, fourth branchial arch thyroid and other cartilages. We know the blood supply, we know the nerve supply, and we know the muscles. I hope this helps.